All right, you guys, welcome to our healthcare series. This is episode number 1. If you're new to the channel, like the video and subscribe. Today we are going to be talking about things for older people, okay? If you think you will get older one day, this is the video for you. If you are currently old, then definitely watch. Let's have a discussion about this stuff in the comments section. Is there anybody else who's having issues with their hands and you're worried and you don't have the same health care or you can't afford health care? So today we're going to talk about things like weakness in your hands if you're possibly suffering from it, and then we're going to talk about ways that they say you can help with those type of situations. And you guys, everybody gets old. That's why I do want to say everybody gets old, okay? So if you are laying on your hands or, your hands are becoming stiff, then let's talk about that. Okay, so if you're experiencing weakness in your hands, this can be frustrating. If you are suffering from numbness in your hands, a weak grip, or difficulty carrying otherwise manageable items, you are not alone. Thousands of patients worldwide report experiencing weakness in their hands as a result of nerve damage. So that's what's causing you to not be able to do the same things as simply as lifting, something. Okay, so look, that occurs with age, and they said it's symptoms of an injury, okay, or an underlying medical condition. So while suffering, is what would be the situation, because this is happening because your hands are developing weakness, okay, which can be frustrating, all right? And there's ways that you can alleviate these symptoms and regain strength in your hands again, okay, so that you can resume to your daily responsibilities, all right? So look, let's get into how to relieve yourself from the discomfort in your hands. All right. So, you guys, exercise. I guess that should be common, okay? I always suggest an exercise ball, one that you can... I need to get that for my mother, actually, since I'm talking about this. Hello, Mom. Okay, so look, basic exercises can help restore strength in your hands and speed up recovery from your injuries, okay, or underlying conditions. That's what I want to talk about, you guys. That could be causing these issues for you. So light exercises such as making a fist, stretching your fingers, stretch them, gripping, or pinching items such as a stress ball, and extending your fingers such as your thumbs these are simple ways that you can work out your muscles, okay, and restore strength in your hands. If you're seeking a simple at-home treatment for weakness in your hands, this is a great option, okay? So you should stretch. That's number 2. That's one of the easiest and most effective ways to treat issues in your hands. It's by gentle stretching. Taking the time to stretch the muscles in the hands gently can help improve the mobility, as most people have dominant flexors, okay? The muscles used for gripping and holding on to things in the hands while creating an imbalance and weakness in the extensor muscles. Okay, so number 3 is over-the-counter medications. While weakness in hands is not typically painful, it can come with a moderate level of pain or overall discomfort. Over-the-counter pain medications such as ibuprofen or other aspirin can help provide relief for some of the unwanted feelings associated with weakness in the hands. Okay, so especially when coupled with a period of immobilization or light exercise. Be sure to consult your doctor before trying any medications, as there could be negative interactions with current medications you might be on. Okay, so neuropathy treatments for weakness in hands. They're trying to say that if you're still suffering from weakness in your hands after resting, exercising, and taking over-the-counter pain medications, you may need to treat damaged nerves at the source. Okay, so you'll want to consult your healthcare provider with specializing in treating neuropathy and its many uncomfortable symptoms, including weakness in the hands. Our innovative and exclusive treatment system effectively increases blood flow to the nerves in the hands, which helps to rejuvenate nerves naturally and can improve strength and alleviate pain. Okay, so their treatments don't require surgery or any other harmful medications. So they're just trying to say that if you're having weakness in your hands, it's easier ever than before to get this treated. Okay, so yeah, you guys, if this is happening to you, let's talk about it in the comments below, and like the video, you guys. If you're new to my channel, welcome, and let's get into talking about more of this, you guys, because this is just the beginning. Okay, so let's talk about the causes and the treatment for numbness in the hands. Okay, so numbness in your hands can mean many things. You need to think about how often and when it happens. Okay, how long it lasts, and what other symptoms you might have. Your healthcare provider can help you find out what could be causing your hands numbness and then help you find the best way to treat it. Okay, so look, what is numbness in the hands? Numbness in your hands is an irregular feeling that can be a symptom of many different conditions. Okay, another name for this is parathesis. It sounds like that's what they're saying it's called. You can also have tingling along with numbness in your hands, something you might call pins and needles. It sounds awful, right? But the possible cause is this. They're saying numbness in your hands can be a symptom of many causes, which run from mild to temporary to serious medical conditions. So the most common cause is damage or compression of the nerve in your hand. That's what causes this numbness in your hands. Maybe you slept too long in one position or leaned on your elbows for too long. Maybe you have a lump or bump that's putting pressure on your nerves. Other causes of numbness in your hands, they're trying to say a herniated disc that puts pressure on your spinal nerves. Okay, then they said nerve damage in your hands, arms, and neck. I guess in another area that could be causing you issues. They said nerve pressure caused by tumors, infection, or enlarged blood vessels. Okay, then they're saying carpal tunnel syndrome, a common condition that affects the nerves in your wrists. This often happens when people use their hands and wrists for repetitive motion at work. So they said nerve compression from bending or leaning on your elbows too long. Your hands can go numb from other diseases, including shingles, herpes infection, stroke, poor circulation from diabetes, migraine headaches, underactive thyroid. Okay, that has to be the one happening for a lot of people. Lyme disease, multiple sclerosis, Rodney syndrome, underactive thyroid. Other causes may include animal or insect bites, certain medications, excessive alcohol use, abnormal levels of calcium and potassium or sodium. What tests will your healthcare provider do to determine the cause of your hand numbness? Okay, your healthcare provider will begin your examination by taking a medical history to find out how long your hands have been numb, people, and other possible symptoms. Also, don't forget to like and subscribe, and check out my prison series, my death series, and listen to me talking about Diddy, you guys. Okay, so they may perform several tests to determine what's causing this, like your blood count, your thyroid function test of your electrolytes levels, toxicology report test that measures the substance in your system. So your provider conducts tests to rule out serious causes like tumors and strokes. Okay, so they would also do ultrasound of neck vessels, MRI of your head and your spine. That's magnetic resonance imaging. CT scans of your head and your spine. They would do x-rays. So they would do a lot of stuff, you guys, to see what's going on with your nerves. Okay, so once your healthcare provider determines the cause of your hand numbness, they'll speak with you about the best way to treat this underlying condition and the symptoms. Okay, so how is numbness in your hands treated? Treatment for numbness in your hands will depend on what's causing it. For instance, if medication is causing numbness in your hands, your provider may be able to switch it to another type of drug. This just sounds awful. Just try to imagine. If it's not happening to you, imagine how this would make you feel. Okay, so if you have a vitamin or mineral deficiency, your provider may suggest you change to foods, okay, and take some type of supplement. Some treatments may be surgical procedures. You might need a procedure if you have a tumor, a back problem, or carpal tunnel syndrome, okay? Your provider may suggest you see other providers, okay? So you guys, this is pretty scary. It's pretty scary. That's what I'm going to say right there. All right, so look, like those who practice in surgery or pain management or neurology or etc., what can I do at home to treat numbness in the hands? Okay, we're finally at this point. Okay, so here are some of the remedies. Wear splints on your hands as recommendations. We will have to look that up. Taking over-the-counter pain relievers like ibuprofen, other aspirins. Using heat or cold therapy. Doing exercises that help your hands get stronger. Resting your hands if you use them for repeated tasks. What are the possible complications or risks of not treating numb hands? Oh no. Your hands are numb because of something minor or temporary. If your hands are numb because of a more serious reason, you'll need treatment for underlying causes. Okay, so can numbness in your hands be prevented? You may be able to prevent numbness in your hands from certain causes. You can do your best to manage chronic conditions like high blood pressure and diabetes. Have regular medical tests. Take breaks if you use your hands for repeated tasks. So when should you call your doctor? When should hand numbness be treated by a healthcare provider? You may wonder when you should worry about hand numbness. If numbness in your hands lasts for more than a few hours, or if you notice that it comes and goes, you should seek proper medical attention. It could be a sign of a more serious medical condition. It's especially important to seek medical attention if your hands are numb and you have the following symptoms: paralysis, confusion, dizziness, slurred speech, a rash, numbness in other parts of your body, loss of bowel and bladder control. It all sounds crazy. Okay, so if you've woken up and found that your hands or arms are numb because you slept soundly in one position all night, maybe tingling or that pins and needle feeling or burning following the numbness, this happens once in a while, you're not likely to worry. But if hand numbness happens more often and if it occurs with other symptoms, this is when you should make an appointment with your health care provider so you guys can find out what is going on ASAP. Okay, you guys, like the video, subscribe, and I will see you on the next one.